Section A, Overview and Context. Background. Terms of reference. The Health and Disability System Reviews terms of reference encompass the overall health and disability system as set out in legislation. Require the review by March 2020 to deliver final recommendations to the government on a future health and disability system that is sustainable, is well placed to respond to future needs of all New Zealanders, and shifts the balance from treatment of illness towards health and well-being. The panel will recommend how the system could be designed to achieve better health and well-being outcomes for all, ensure improvements in health outcomes of Māori, ensure improvements in health outcomes of other population groups, reduce barriers to access to health and disability services to achieve equitable outcomes for all parts of the population, improve the quality, effectiveness, and efficiency of the health and disability system, including institutional, funding, and governance arrangements. Outside the scope of the review are the Accident Compensation Scheme, although the relationship between the health and disability system and the compensation scheme is in scope. The Pharmaceutical Management Agency, PHARMAC, although the relationship between the health and disability system and PHARMAC is in scope. Private health insurance, although its interactions with demographic drivers of healthcare need is in scope. The Mid-Central Prototype for Disability Service Delivery that is underway, although lessons from this work will be considered when the review's recommendations are developed. People and communities. The next 20 years will bring sizable shifts to New Zealand's population in terms of age, ethnicity, and geographic spread. Environmental, social, technological, and cultural changes also will provide both opportunities and pressures on the sustainability and efficiency of the health and disability system. New Zealanders told the review that their health and well-being is important and needs to be prioritised and protected. Many wanted the system to be more accountable and transparent, and to be heard, seen, listened to, and treated fairly. Consideration of changes to the health and disability system to effectively address inequities and improve health outcomes requires us to have a good understanding of population characteristics both now and in the future. As a whole, New Zealanders are living longer and healthier lives, with high levels of self-rated health and well-being and good access to acute and emergency care. A dedicated health and disability workforce delivers services each day to thousands of individuals and their whānau across an extensive hospital, community, and home-based network. Compared with the OECD, New Zealand's expenditure on health as a proportion of gross domestic product is in the mid-range, but key outcomes such as life expectancy at birth are above average. However, the health and disability system is under pressure and does not cater well for all. Despite progress, outcomes are not equitable across populations and life course, particularly for Māori, Pacific peoples, disabled people, and people experiencing poverty. Rural New Zealanders also need sustainable and equitable access to health and disability services. Focusing on what New Zealanders value to improve their health and well-being remains critical, including the quality, diversity, transparency, and the timeliness of the health and disability system.
People of Aotearoa New Zealand. The statistics and background information set out in the interim report remain valid and are not repeated here in full. Rather, some tables have been included to describe the population and community's context in which the review's final recommendations are set. Diverse populations. Aotearoa New Zealand is a diverse society. It has a large Indigenous Māori population and other cultures, including significant Pacific and Asian populations, with the majority New Zealand European/Pākehā. The characteristics of New Zealand's ethnic populations vary significantly. As Indigenous population, Māori are highly connected through whakapapa, and the well-being of individuals is strongly associated with the well-being of whānau. Their ability to access and participate in Te Ao Māori, Māori worldview, and their culture connections provide a strong and enduring sense of identity and are prerequisites to good health. Pacific peoples are a young and diverse population made up of cultures from many different Pacific islands. There are more than 40 Pacific ethnic groups in New Zealand. Pacific peoples share cultural values such as the central place of family, collectivism, communitarianism, and the importance of spirituality, reciprocity, and respect. The Asian population is very broad, comprising ethnic groups from Afghanistan to Japan. Despite this diversity, Asian New Zealanders share common values, such as those based on family, education, and community ties. They also share the experience of negotiating between traditional values and those of the dominant Pākehā culture. New Zealand Europeans, Pākehās, are people of European ethnicity. The median age for New Zealand Europeans is 40.5 years, almost 20 years older than the Pacific populations. The New Zealand European population aged over 85 is 4 to 8 times higher than other population groups. In addition, a quarter of New Zealanders live with one or more disabilities. Māori have significantly higher rates of disability over all age groups. 11% of children are living with disabilities, 21% of young and working age people, and 59% of seniors. The number of New Zealanders living with disability is increasing. The range of impairments is diverse, and the impacts on people can vary substantially. New Zealand is also becoming more religiously diverse. Other than Christian groups, other religious groups include Hindu, Buddhist, Muslim, Sikh, and Jewish. Non-Christian religious groups have increased from 4% of the population in 2001 to around 6% in 2013, and around 40% of the Asian population affiliate with a religion other than Christianity. New Zealand's mental health challenges and suicide rates remain high, recognised by the government's recent acceptance of the many recommendations from the government inquiry into mental health and addiction. Suicide rates remain higher for males than females, for Māori and non-Māori, and for people in rural areas than in urban areas. Patterns for use of both inpatient and community mental health specialist services show higher rates for Māori Pacific peoples, recently released prisoners, young people aged 13 to 24, and those who are people who identify as LGBTQIA+. If New Zealand is to address the inequities that currently exist in health outcomes, the health and disability system needs to recognise, design and deliver services to meet the differing cultural beliefs and worldviews of its diverse populations.
Changes to population and communities. New Zealand's population is projected to grow by 1 million people over the next 20 years. Over half of this population increase will identify with Asian ethnicities. The median age of all ethnicities will increase, with the number of people aged over 85 more than doubling. This changing age profile will mean there will be a significant increase in the working age dependency ratio, from 55 dependents to 100 people of working age in 2018 to 65 dependents to 100 people of working age in 2038. However, projections from Stats NZ assumes more people will stay in paid work past the age of 65, making the increase in the dependency ratio smaller. There will be increasing demand for health and disability services as use and complexity increases with age, and increasing prevalence of impairments and comorbidities. Changes are also forecast in the distribution of where people live and work. Although around half the population will increase over the next 20 years will be in Auckland, increasing Auckland's population by 23%, rural areas are projected to grow slightly faster than main urban areas at 14%. Demographic growth and ageing will contribute to an increase in demand for health and disability services throughout the country. This will be felt most acutely in Auckland, where the forecast population growth over the next 20 years is larger than the current population of 16 of the 20 DHBs. Socioeconomic deprivation and geographic differences. By population size, New Zealand Europeans are the largest ethnic group living in the highest quintile of socioeconomic deprivation. Some population groups are significantly more likely to live in high deprivation areas. This includes 40% of Māori and more than half of the Pacific population. The North Island and some regions in particular have significant higher rates of socioeconomic deprivation than others. Over a third of the population in Northland and nearly half of the population in Tiriti live in the highest quintile of socioeconomic deprivation. There are also large numbers of people living in socioeconomic deprivation in Auckland, including almost all of South Auckland is in the two highest quintiles, with large areas in the highest quintile. Significant parts of West Auckland also have high socioeconomic deprivation, and there are small pockets of high deprivation in central Auckland and the North Shore.
The compounding effects of socioeconomic deprivation on health outcomes are well researched. For example, people living in more socioeconomically deprived areas are 2.5 times more likely to experience psychological distress than those living in less deprived areas. The rates of mental health service use are also significantly higher among those from high socioeconomic deprivation quintiles. Interactions between ethnicity, socioeconomic deprivation, age, disability, and geographic location exacerbate inequitable outcomes and access to healthcare. DHB populations vary significantly. The characteristics of DHB populations vary significantly by scale, density of population, ethnicity, age, profile, and deprivation, as outlined in the figure. Across DHBs, there is a correlation between deprivation and poor health status.
Addressing the equity challenge. The interim report noted that the urgency for making improvements to outcomes for Māori, Pacific peoples, and low-income and rural households requires ensuring the principles of Te Tiriti o Waitangi are incorporated and Mātauranga Māori is embedded throughout. Priority should be given to the designing services for these communities rather than simply making system-wide changes in the hope that the benefits trickle down. Focusing on child and maternal well-being to ensure more equitable outcomes for the next generation of Māori and Pacific children. The first 1,000 days of a child's life is a critical time for development and sets the stage for physical and mental well-being throughout life. The long talked about move to give more emphasis to preventative care and the promotion of wellness needs to become a reality. This would require more multidisciplinary services and reduced dependence on models that focus on throughput. Change is also required to ensure disability is no longer treated as an exception or managed separately. The increasing number of disabled people have the right to expect equitable outcomes from the system, and the system should ensure services strive to achieve that. Services are designed to be effective for frail older people and the increasing number of people living with complex long-term conditions. Service delivery will also need to change. Health services need to be planned more strategically, with more meaningful engagement with communities and better connections to other agencies with responsibilities that impact the socio-economic and cultural determinants of health. Workforce strategies need to be strengthened to ensure the future workforce better reflects the community it serves and has the skills necessary to operate effectively under different models of care.
Hauora Māori, Māori Health. Hapaitia te ara tika pūmau ai te rangatiratanga mō ngā uri whakatupu. Foster the pathway of knowledge to strength, independence and growth for future generations. Improving equity and well-being for Māori requires immediate improvements in the way the system delivers for Māori, a growth in the range and distribution of kaupapa Māori service and providers, and enhancements to rangatiratanga and mana motuhake. The most visible sign of the latter will be the establishment of a Māori Health Authority with direct accountability to the Minister of Health for all advice, monitoring and reporting with respect to Māori health. All recommendations proposed by the review are designed to improve the effectiveness and the equity of outcomes for Māori, but this chapter has focused on the structural and cultural shifts necessary. The interim report examines in detail the evidence of the inequities and poor outcomes for Hauora Māori, the contributing to these inequities, and noted several directions for change. To transform Hauora Māori, one of our country's greatest health risks, to one of our greatest achievements, the future health and disability system needs to look, act and work differently to make a positive difference in the lives of iwi, hapu and Māori whānau in Aotearoa, New Zealand. As Tā Himi Hinari, Sir James Hinari Ngāti Hine stated, kua tawhiti ki te haerenga mai kia kore e haere nui rawa o mahi kia kore e mahi tonu. You have come too far not to go further. You have done too much not to do more. The review agrees that the future integrated health and disability system for Aotearoa New Zealand requires progressive thinking to realise Māori success. It has identified areas of urgent concern and changes that are critical. The review recommends incorporating Te Tiriti or Waitangi principles across the system and updating legislation accordingly, establishing a Māori Health Authority, provisional name only, reflecting Te Tiriti partnership and governance structures, investing in kaupapa Māori services, embedding Māori knowledge and worldwide perspectives across the system. The review also recommends an increased emphasis on health equity and quality improvement performance for Hauora Māori. This requires updating the equity clauses in legislation, addressing racism and discrimination, inclusive of improving cultural safety, higher health and disability system to address equity issues at all levels. The review recognises that systematic inequity cannot be addressed through piecemeal initiatives alone. This entire report is aimed at addressing inequity, and it will be important that the issues are addressed from all angles. Te Hauora Māori ki tua future of Hauora Māori. He rangi tā mata whaiti, he rangi tā mata whānui. A person with a narrow vision has a restricted horizon. A person with wide vision has plentiful opportunities. Pai ora. Healthy Futures is the government's vision for Māori health. It provides a platform for Māori to live with good health and well-being in an environment that supports a good quality of life. The review heard from the Māori Expert Advisory Group, wānanga participants and other stakeholders that iwi, hapu and whānau want a system that is more aspirational and inspirational. The review was urged to propose a system that saw beyond just equity. MEAG's advice on Māori aspiration: whānau are living healthy and thriving lives as Māori and as valued citizens of New Zealand. Māori enjoy equity of access, quality of care and outcomes. This is the norm for New Zealand. All health services will be viewed by whānau as agile, barrierless, and an easy pathway to improved health and greater well-being. New Zealand's health workforce is envied globally for its inclusive and partnered delivery culture. New Zealand has a system that is free of racism and is dominated by culturally safe and competent delivery practices. The system has strong and interconnected partnership with others that are engaged in addressing the social determinants of health. As a first step, the review believes the health and disability system must create opportunities for Māori to exercise their rangatiratanga, mana motuhake, and whānau rangatiratanga. Pai ora encourages everyone in the health and disability sector to work collaboratively, to think beyond narrow definitions of health, and to provide high quality and effective services. The health and disability system envisaged by the review would help achieve pai ora, and by ensuring the principles of Te Tiriti are upheld, that there is respectful application of te ao Māori leadership and knowledge, inclusive of mātauranga Māori and kaupapa Māori, and a whole of system commitment to and ownership of achieving Māori health equity and well-being. Te Tiriti o Waitangi, Treaty of Waitangi. Mā pango, mā whiro, ka oti te mahi. With black and with red, the work is completed. Developing an effective Tiriti treaty-based partnership within health that delivers a health and disability system that works for Māori. Te Tiriti o Waitangi, the Treaty of Waitangi, must be fully incorporated to provide a framework for meaningful and substantive relationships between iwi, Māori and the Crown. This will provide a positive flow-on effect linked to leadership, governance and decision-making, and assist in strengthening Māori provider, workforce and service development. For Hauora Māori, the review was guided by a vision of creating a more effective health and disability system that produces equitable health outcomes for whānau, hapu and iwi. For Māori, this requires that rangatiratanga and mana motuhake is demonstrated throughout the system. Te whakahau I te wahi ki te tiriti o Waitangi I roto te pūnaha, updating te tiriti o Waitangi in the system. The review considered recommendations of Hauora report on Stage 1 of the Health Services and Outcomes Kaupapa Inquiry Hauora Report Y2575, regarding primary health care as to how health and disability system legislation should be updated. While it is not the responsibility of the review to respond to the Hauora report, the findings of the report were a valuable contribution to our analysis. The Hauora report recommends amending sections of the New Zealand Public Health and Disability Act 2000 to ensure the whole health and disability system complies with Te Tiriti principles. The report also recommends updating Te Tiriti principles used in the health and disability system. The review agrees that Te Tiriti section in the overarching legislation should be updated to ensure it reflects more recent interpretations of Te Tiriti and is consistent with any new public service legislation provisions. While the detailed wording of such provisions is beyond the review, appropriately updating the principal legislation for health would support Te Tiriti principles being applied through the entire system. Te tautoko I ngā huarahi e whai wahi ai te rangatiratanga me te mana motu hake, supporting opportunities for rangatiratanga and mana motu hake. The review recommendations regarding how best to achieve rangatiratanga in the health and disability system have been guided by several factors. A recognition that the principles of Te Tiriti must be fully incorporated in how the health and disability system works if it is ever to serve Māori well. A recognition that the current system has failed Māori. To remedy this failure, there will be significant changes in the way the health and disability system is designed and services are delivered. An acceptance that remedying decades of underperformance by the health and disability system will require changes so that Māori expertise and more effective services can be designed and embedded into the system. The review's recommendations aim to enhance rangatiratanga and mana motu hake opportunities within the health and disability system. Achieving this includes the formation and operation of an independent Māori health authority, changes to the governance arrangements, and ensuring that equitable funding allocations and expenditure properly reflect the higher needs of Māori communities. Tirohanga whānui ki te mana Hauora Māori. Overview of the Māori Health Authority. The review is recommending that a Māori Health Authority be established as an independent departmental agency with direct accountability to the Minister of Health. The Māori Health Authority would sit alongside the Ministry of Health, the Ministry, and have a similar range of functions relating to Māori health as the Ministry does for the overall system. The Māori Health Authority would be a partner to the Ministry. It would also develop working relationships with Health NZ, DHBs, Māori health providers and consumers, and other key stakeholders such as the Health Quality and Safety Commission, the new Mental Health and Wellbeing Commission, and the Cancer Control Agency. The Māori Health Authority would act as a kaiarataki steward of Hauora Māori across the health and disability system. Its key functions would include policy, growing and supporting Hauora Māori models of care, growing kaupapa Māori services, and developing the Māori health workforce and Māori health providers. It would also monitor and report on the health and disabilities performance in achieving equity and improving health outcomes for Māori. While the Māori Health Authority would assume all the current functions of the Māori Health Directorate within the Ministry, this would not absolve the rest of the system from ensuring they act in accordance with the principles of Te Tiriti and for achieving equity, access, experience and outcomes and well-being for Māori. Ngā mahi a te mana Hauora Māori. Functions of the Māori Health Authority. The Māori Health Authority would be responsible for the following functions. Te tohu I te minita mō ngā āhuatanga katoa o ngā kaupapa here Hauora Māori, advising the Minister on all aspects of Māori health policy. The Māori Health Authority would be the principal advisor to the Minister on Māori health. It would be responsible for developing, updating and monitoring He Korowai Oranga, the Māori Health Strategy, and implementing the Māori Health Plan across the system. Lead, support and advise on intersectoral activities to improve Māori health aspirations such as the Child Wellbeing Strategy, the Whānui Program with Te Puni Kokiri Ministry for Māori Development, and Māori Crown relationships with Te Arawhiti, the Office for Māori Crown Relations, and engage with other sector stakeholders such as the new Mental Health and Addictions Commission and the Health Quality and Safety Commission. Provide advice on the appointment of Māori members on Health NZ and DHB boards. The Health and Disability System will see coordinated efforts on Māori health between the Māori Health Authority, the Ministry and Health NZ. The clinical, cultural, system and service level intelligence provided by the Māori Health Authority will be used by the Ministry to draft policy, by Health NZ to produce accurate health needs assessments, and by DHBs to produce accurate locality plans and to commission and deliver network health services. Te whakahoa me ngā wāhanga katoa o te pūnaha, partnering with all other parts of the system. The Māori Health Authority would partner with the Ministry to develop expectations in the long-term services plan for improved service delivery to Māori communities and whānau. It would also partner with the Ministry to ensure all health strategies prioritise achieving equity for Māori, Māori workforce and provider development, and incorporating the role of mātauranga Māori and kaupapa Māori in the health and disability system and services. Health NZ to develop the principles and rules for health service commissioning as it relates to Māori equity and well-being. This includes commissioning related to kaupapa Māori services, the respectful use of mātauranga Māori and in particular effective commissioning of local Tier 1 networks. This also includes the Māori Health Authority developing outcomes measures for Māori health and system-wide adoption and implementation. DHBs in undertaking Māori health needs assessments and locality plans within Māori communities in localities where there is a DHB and iwi partnership, the Māori Health Authority will fully support these relationships and there will be an opportunity to co-govern and co-develop services within the rohe. Te aro turuki me te pūrongo ki ngā huanga Hauora Māori me te whiwhinga orite, monitoring and reporting on Māori health outcomes and equity. The Māori Health Authority would provide Māori health leadership and intelligence for the health and disability system alongside Māori intelligence within the Ministry, Health NZ and DHBs. The Māori Health Authority will monitor and report to the Minister on the performance of the health and disability system with respect to Māori health equity and it would provide advice on Māori health priorities at a population level, driven by population data. It would be equally important to use kaupapa Māori and mātauranga Māori methodologies and input from whānau rangatiratanga in any Māori health needs assessment and analytical work. Māori equity-focused insights and analytics would be required for all outputs from Health NZ as the lead advisor on DHB performance, along with the Ministry as the monitor of system performance. The Ministry, Health NZ and DHBs would be using Māori health and disability data routinely in their policy advice, strategy, ongoing systems design and service delivery. Te haumi ki ngā rātonga me ngā kaituku Hauora kaupapa Māori, investing in kaupapa Māori health services and providers. As well as ensuring Māori services and the Māori workforce grows, it will be important to develop and implement policy to grow the number and range of kaupapa Māori service providers. The vision is for kaupapa Māori services being equitably available to Māori communities across the country and across Tier 1 services, based on life course needs, pepi to kaumātua, from child wellbeing to mental health to older persons and palliative care. This will require a deliberate and sustained effort for change, alongside dedicated investment that should be led and commissioned by the Māori Health Authority. See also more detail in the Mātauranga Māori section in this chapter. Te whakawhāneke me te arataki I te whakatīnangatanga o te rautaki o Mahi Hauora Māori. Developing and leading the implementation of the Māori Health Workforce Strategy. The Māori Health Authority would be responsible for developing and implementing a Māori Health Workforce Strategy. This includes leading and supporting Māori workforce development and engagement. For example, through supporting the Māori workforce and identifying and developing emerging Māori health leaders as part of a succession plan approach. This would include responsibility for the National Māori Workforce Development Fund, system-wide target setting and monitoring. The Māori Health Authority would partner with the Ministry to ensure other health workforce strategies also recognise the need for building the Māori health workforce and growing the cultural safety and cultural competence of the non-Māori workforce. See also the Workforce chapter. Other governance arrangements of rangatiratanga and mana motuhake would also be enhanced by increasing the Māori Crown partnership across the health and disability system. The review recommends ensuring equal representation of 50-50 Māori and Crown membership is adopted for the Health NZ board. It is also recommended DHB boards, independent commissions, and other boards across the health and disability system reflect Te Tiriti partnership. Mātauranga Māori, Māori knowledge systems. Mā te mātauranga Māori, ka ora ai te whānau, te hapu, te iwi. Through Māori knowledge, the family, the sub-tribe, and the tribe prosper. The interim report noted the importance of Mātauranga Māori as a vehicle to provide cultural constructs for improving Māori health and well-being and the delivery of healthcare and services in Māori communities. It was also acknowledged that the last 4 decades has seen a positive era in which Mātauranga Māori is starting to be incorporated into healthcare. There has also been an increase in Māori health services offering kaupapa Māori services or mātauranga approaches as alternative or complementary care options in the health and disability system. Māori leadership and control over using and applying mātauranga in contemporary health settings is critical to ensure the appropriate protections and processes are in place to protect the integrity of mātauranga in health. Mātauranga Māori is led by Māori and should be at the centre of any service delivered to Māori. The review supports Mātauranga Māori being embedded in the health and disability system and that it should recognise the holistic approach to Mātauranga Māori towards health and wellness as being more than just a cultural option. It should be an integral part of the system. In order to both embed Mātauranga Māori practices and to safeguard and protect their cultural integrity, there are several considerations that would need to be addressed. Te whakauru I te Mātauranga Māori ki te pūnaha, incorporating Mātauranga Māori across the health and disability system. In order for Mātauranga Māori and kaupapa Māori solutions to be incorporated into the health and disability system, there would need to be ongoing and enhanced integration of Mātauranga Māori in health services, appropriate levels of funding, and strong organisational leadership. Finally, given previous challenges to effectively monitor and report on the impact and effectiveness of Mātauranga Māori in improving healthcare, there is a need for culturally relevant evaluations and assessment mechanisms to complement existing measurement tools. Investing in Mātauranga Māori ways of working and embedding these into health services could provide additional options and choice for Māori health consumers and their whānau rangatiratanga. In practice, this means that tikanga Māori should be applied as a norm in delivering health services for Māori whānau and communities. For example, tikanga guidelines for hospitals and apps. Further, given that tikanga can and often does differ between different iwi rohe, the role of mana whenua in developing guidelines and processes so there is an appropriate application of tikanga for the rohe will be crucial. In order to embed mātauranga Māori practices across the health and disability system and safeguard and protect their integrity, there are other considerations that will need to be addressed. Embed mātauranga Māori practices, tikanga, ritenga, maintaining cultural integrity, quality and clinical safety and standards, kaitiakitanga, nurturing and protecting cultural practices, respect for traditional ownership of healing concepts and properties, and protecting against the commercialisation and commodification of traditional practices. Ngā rautaki haumi, finding and supporting for the implementation of mātauranga Māori approaches in health. Whakawhāneke ngā kaimahi, support for and development of mātauranga Māori practitioners and developing the competence and confidence of non-Māori health workers. Arotakinga, assessing intervention, integrity, measurement of effectiveness and monitoring and accountability. The Māori Health Authority would be responsible for ensuring policy is developed and will oversee the effective implementation of these policies through its relationships and accountability settings with the Ministry, Health NZ and DHBs. Te whakahaumi ki ngā rātonga Hauora kaupapa Māori, investing in kaupapa Māori health services. Health services are delivered for Māori in a number of settings and can be characterised as general services, services delivered under the principles of universality and consistency for all populations. They are not specifically designed with Māori in mind and are based on non-Māori models, for example, GP services. Taha Māori services deliver Māori services in parallel to or alongside general services. These services often employ Māori staff, are underpinned by either tikanga Māori or bicultural practices and values and may arise from a focus on Māori health equity, for example, the Mason Clinic. Kaupapa Māori services, led, owned and governed by iwi, pan-tribal or Māori organisations that are specifically designed with Māori in mind, for example, Oratoa or Ngāti Porou Hauora. Health and disability services delivered for Māori. General, involving Māori and non-Māori provider. Taha Māori, focus on Māori and non-Māori provider. Kaupapa Māori, led by Māori, Māori provider. To achieve equity for Māori, there is a need to invest in kaupapa Māori services. Kaupapa Māori services are synonymously linked to mātauranga Māori and underpinned by te Tiriti or Waitangi, self-determination, cultural validity, culturally preferred teaching, socio-economic mediation of Māori disadvantage, whānau connections, collective aspirations, and respectful relationships underpinned by equality and reciprocity. Kaupapa Māori services should have clinical proficiencies that will respond to the clinical and health needs of the person and their whānau. Knowledge of te reo Māori and tikanga Māori underpins both contexts, as does clinical quality and competence. Investing in kaupapa Māori health services provides additional options and choice for Māori consumers. Based on Māori consumer experiences, the most frequently recommended actions to improve Māori experiences of healthcare included integrating tikanga into all health services and increasing Māori workforce capacity and involvement in developing health services. In particular, Māori consumers wanted to see an expanded use of tikanga and culturally safe and competent practice in health services. This requires capacity building to support Māori participation in the health workforce and in developing health services, Māori access to responsive clinical services based on Māori consumer needs and expectations, health and disability system level strategies including appropriate and equitable funding to develop kaupapa Māori health services, developing culturally relevant interventions for whānau rather than individual-centred care. Investing in kaupapa Māori health services would improve Māori experiences of healthcare. To ensure services are available throughout the country, DHBs should be required to include kaupapa Māori health services in all locality planning. Te whiwhinga orite mō ngai Māori, health equity for Māori. Mā me orite te rāranga ai ngā pū manawa, weaving the realisation of potential together. The Ministry of Health acknowledges that the New Zealand population has differences in health that are not only avoidable but unfair and unjust, and defines equity as recognising different people with different levels of advantage require different approaches and resources to get equitable health outcomes. Inequitable access to health services, the social and economic determinants of health and multi-levelled. The review sees that the improvements in Māori health outcomes will come from better primary and community care services being provided in ways that are more accessible and appropriate for Māori communities. This will require a much greater focus on understanding the health needs of Māori communities, addressing these needs in a more connected way, and expanding outreach and home-based care, and addressing the social and cultural determinants of health. The proposed solutions are discussed in detail in the Tier 1 chapter. Te mātua whakarite he rātonga tika, whai hua haumaru hoki ki ngā whānau Māori, ngā hapu me ngā iwi, delivering culturally safe, competent and effective services to Māori whānau hapu and iwi. Māori access non-Māori provider services across the health and disability system. Future investment is required to build the capability and capacity of the non-Māori workforce and providers. All health services in Aotearoa New Zealand must have the capacity to engage with Māori in ways that endorse Māori cultural identity and the relevance of Māori values and approaches to addressing health and wellness. Providers be required that can deliver high quality care and equity for Māori, in addition to a general expectation that work and service delivery is culturally safe, competent and clinically effective for Māori. There needs to be specific investment strategies to increase understanding. These could range from non-Māori workforce and organisational development through to equity-based standards, regulations, performance monitoring and management tools and frameworks. The Māori Health Authority would lead some of this work, and it is anticipated that the Ministry, Health NZ, DHBs and others would lead other components within a pro-equity system. Te whakahau I ngā wāhanga, whiwhinga orite o roto I te ture. Updating the equity clauses in legislation. The review recognises that as legislation is developed to incorporate the changes in the health and disability system, updating equity clauses would also be necessary and performance against equity objectives monitored across the system. Te whakatau I te whakatoihara iwi me era atu momo whakahāwea, addressing institutional racism and other forms of discrimination. The interim report outlined evidence about the impacts of racism on Māori health. Submissions from Phase 1 of the review identified the following approaches to addressing racism, including a commitment throughout the health and disability system to address institutional racism, developing a diverse health workforce that is representative of New Zealand's population groups, co-designing health equity research with Māori to inform all health policy development, developing a national action plan to eliminate racism, as well as measures to develop a culturally safe and competent workforce, increasing Māori participation and decision-making powers in consultation processes for redesigning services, increasing support and capacity building to enable Māori to fulfil leadership and governance roles, developing robust evaluation and quality improvement processes to monitor and evaluate the performance of the system in eliminating institutional racism, recognising and responding appropriately to Māori health needs and ensuring Māori worldviews and mātauranga Māori are embedded throughout the health and disability system. The review is aware that the latest draft of the Māori Health Action Plan by the Ministry includes a program of work to address racism and discrimination in the health and disability system. The Māori Health Authority will continue a dedicated approach to this work and work collaboratively with others to ensure system-wide ownership and delivery against this program. Te whakatipu I te ohumahi Hauora, growing the Māori health workforce. The interim report highlighted that a diverse and representative health force that understands the importance of achieving health equity is critical to delivering equitable health services to Māori. The interim report identified the continued underrepresentation of Māori in the health workforce as a gap that requires urgent action. Developing the Māori health and disability workforce is a key enabler for improving equity and achievement, better health outcomes for Māori. Ideally, the ethnic distribution of each health workforce in New Zealand would match the ethnic population distribution they are serving. No profession has reflected the expected ethnic population distribution, and this has not changed over time. The review also acknowledges some progress has been made to grow the Māori workforce. For example, DHB targets to increase Māori workforce participation and other efforts. See the following case study from Waikato DHB. It is proposed that the Māori Health Authority leads the development and implementation of a Māori health workforce plan and equitable investment strategies. See also the workforce chapter. Case study. Puna Waiora. Puna Waiora is a new kaupapa Māori support system offered by Waikato DHB, empowering and supporting rangatahi young Māori to pursue a career in health. The program was launched on 1st of February 2019. This program is led by young Māori who are passionate about growing young Māori to pursue health careers. Puna Waiora recognised a need for a Māori-specific health workforce service, and this was evident with the introduction of the Te Tomokanga program, Māori Gateway, where the Puna Waiora team increased the number of Māori Gateway students from 15 to more than 90 in its first year. This meant that the Waikato DHB Gateway program had more than 59% Māori students in 2019, and this had never been done before. In the first year of operation, Puna Waiora supported 5 Māori medium kura to receive additional funding they were eligible for but never accessed. On top of that, one school has received funding for a full-time careers advisor. The Puna Waiora team are all fluent in te reo Māori, therefore enabling them to effortlessly present their mahi in both mainstream kura and whare kura when and how they need it. The program was launched with the Science Expo attended by hundreds of rangatahi, where they were offered hands-on exposure to real careers in health with a variety of healthcare, science and technology experts at Tūranga Waiwai Marae Ngaruawahia. The program is a positive outcome formed from the relationship between Iwi Māori Council and Waikato DHB. The Puna Waiora team, rangatahi-led, aims to inspire rangatahi to be the future of our health and disability system by supporting them with goal setting, hands-on experience and pastoral care. Puna Waiora offers support services to students from Year 9 through to successful employment. Ngā pūtea ake mō te Hauora Māori, Māori health-specific funds. In addition to the recommendations outlined in the funding section, see the governance and funding chapter, such as amending funding formulas to account for ethnicity and deprivation to improve equitable funding, there is a need for specific initiatives aimed at increasing the size and expertise of the Māori workforce, the growth of kaupapa Māori providers, and innovation for Māori population health and other initiatives. There will be a growing need for Māori workforce, kaupapa Māori, and other health services that meet community preferences and needs. The Māori population will grow over the next few decades. It is estimated that Māori children will make up 30.3% of all New Zealand children aged 0 to 14 years in 2038, compared with 25.6% in 2013, and that Māori adults aged over 65 will make up 11.9% of Māori in 2038, compared with 5.3% in 2013. This future population growth, population demographics, and the number of Māori living longer with disabling health effects means the future design of the health and disability system needs to anticipate now what will be needed for Māori. To accommodate the growing demand, there will be requirements to broaden the scope of the Māori workforce and Māori health providers. The Māori Health Authority should be responsible for developing Māori health provider and workforce development strategies to ensure the system has the appropriate Māori workforce, both clinical and non-clinical roles, and the services available to meet the health needs of the Māori whānau and communities. The Māori Health Authority would take over accountability for 3 Māori development funds: the Māori Provider Development Scheme, the National Māori Workforce Development Fund, and Te Ao Auahatanga Hauora Māori, the Māori Health Innovation Fund, Te Ao Auahatanga. These funds are intended to support Māori health providers to grow and innovate and support development of the future Māori health workforce. These funds have been operating for several years and have played a significant role by increasing the number of Māori health providers and the number of Māori participating in health and disability workforce. In line with the review's overall emphasis on ensuring population health drives all service development, the review proposes that these 3 funds, MPDS, MWD, and Te Ao Auahatanga, be increased to provide a broader range and scale of innovations across more priority areas. Increasing Māori provider innovation funding has been identified in the Ministry's draft Māori Health Action Plan. These funds could, for example, be used to establish and develop Māori-specific population health initiatives such as screening, primary prevention, and health promotion programs. More generally, it should be a priority for the Māori Health Authority to review the terms of reference of each of these funds, to update both the scope and the size of these funds, and to advise the Minister on funding priorities in relation to workforce and kaupapa Māori provider development. Te Waihanga I te Āpōpō, Building the Future. The review proposes the following changes. Te whakauru I te Tiriti o Waitangi ki te pūnaha, incorporating Treaty of Waitangi into the system. Te Tiriti o Waitangi sections in health legislation should be updated to ensure they reflect recent interpretations of Te Tiriti principles. An independent Māori health authority should be established as kaiarataki for Hauora Māori, reporting directly to the Minister with the following functions: advising the Minister on all aspects of Māori health policy, partnering with all other parts of the system to ensure mātauranga Māori and other Māori health issues are appropriately incorporated into all aspects of the system, monitoring and reporting to the Minister on the performance of the health and disability system with respect to Māori health outcomes and equity, investing in kaupapa Māori health services and providers, developing and leading the implementation of the Māori health workforce strategy, developing or supporting innovative Māori-specific population health initiatives, reflecting the Te Tiriti partnership in the Crown system through 50-50 Māori Crown representation on the Health NZ board, and ensuring DHBs and other boards also reflect the Te Tiriti partnership. Te whakararo I te mātauranga Māori ki te pūnaha, embedding Māori knowledge systems into the system. The Māori Health Authority should develop and implement policy on mātauranga Māori. Mātauranga Māori should be embedded into all health and disability services. Additional investment should be made in kaupapa Māori health services and providers, and DHBs should be required to ensure kaupapa Māori services are provided for in all locality planning. Te whakawhāneke I te ohumahi Hauora, developing the Māori health workforce. The Māori Health Authority should work with Health NZ to ensure that the whole workforce, organisations and services deliver culturally safe, competent and effective services to Māori. Equity clauses in health legislation should be updated. The Māori Health Authority should work with other parts of the system to ensure the program to combat institutional racism is delivered effectively. Develop the Māori health workforce by ensuring it has a detailed Māori health workforce plan and invests in its implementation. Develop Māori health provider development strategies to ensure there is an appropriate Māori workforce and the range of services to meet the health and disability needs of Māori, whānau and communities. Ensure funding provided for increasing innovation of Māori providers supports the development of more specific population health initiatives for Māori. Review the terms of reference of the Māori Provider Development Scheme, the National Māori Workforce Development Fund, and Te Ao Ōhātanga Māori Health Innovation Fund, and update both the scope and the size of these funds.